Hello, my name is Tara Denner, and I'm an outpatient psychiatric nurse practitioner. In this video, I will discuss how I would address a crisis involving a 19-year-old postpartum patient who presents today with symptoms consistent with acute psychosis. This is her fourth visit, and her husband is present at this visit. She arrives dressed more provocatively than usual, with a heavier makeup setup. Her speech is rapid, loud, tangential. She immediately begins discussing a video series about aliens and makes loose associations between the videos and her baby. She expresses delusional beliefs that her baby is an alien and needs to be taken to the desert and left in the mountains for the aliens to retrieve her. The husband reports she's been acting different for a couple of weeks and is afraid to leave her alone with the baby. She denies suicidal or homicidal ideations, but denial is unrealistic in the content of psychosis. This presentation is highly concerning for a postpartum psychosis, a psychiatric emergency with significant risk of harm to both the mother and the infant. Postpartum psychosis often includes delusional involvement, the infant, rapid mood changes, disorganized thinking, impaired judgment. Risk factors include recent childbirth, sleep deprivation, rapid onset of psychosis, delusional beliefs involving the infant themselves, planning travel to an unsafe environment, and husband's report of behavioral changes. Her belief that the baby is an alien and plan to take the baby to the desert represents an immediate danger to both her and the child. My next step is to ensure that she does not leave the office with the baby. I will calmly explain that she is experiencing some symptoms that require immediate medical attention and that we will need to keep her and the baby safe. I initiate an emergency psychiatric hospitalization consistent with evidence-based guidelines for postpartum psychosis. I would call crisis team or 911 if needed. I would ask the husband to have her assessed at the local hospital emergency room. I ask the husband to remain present and ensure that he understands that she cannot be left alone with the baby. Depending on the state law and the level of risk, Child Protective Services may also need to be contacted. I avoid challenging her delusions directly. Instead, I use grounded statements such as, "You and your baby deserve to be safe. Your mind needs a reset, and the hospital can help with that." Postpartum psychosis requires immediate hospitalization, medical evaluation, possible antipsychotic or mood stabilization, sleep restoration, and continuum monitoring. This continues to carry a high risk of suicide, infanticidal homicide, even when the mother denies intent. I document her psychosis symptoms, delusional content involving the infant, the husband's report, safety concerns, and rationale for hospitalization. I follow the state law for environmental commitment and document infant safety planning as well. I end by summarizing the crisis plan and reinforcement that hospitalization is the safest, most effective way to stabilize her and protect her baby. I assure the husband that he did the right thing by bringing her in and that she will receive the best care possible that she will need. Thank you.